Welcome back to the Premier Life Podcast. It's Allison, and we are starting a discussion. And when I say discussion, I mean that exactly. Please come talk to us more about this when you're in the office. We love giving you more information to make better decisions. And today we're talking about hormone replacement therapy. We're going to cover what it is, the long-term effects of using it, as well as how you can actually support your body's natural hormone production. So we'll start off, what is it? Hormone replacement therapy is typically used to help the body make or have hormones that it's making less of as we age. For women, it's commonly estrogen and progesterone, whereas in men, it is testosterone that they are decreasing their production of as they age. And for women, we're usually using them as to balance the symptoms of perimenopause and menopause. So it is thought to help reduce hot flashes and night sweats, improve sleep, reduce vaginal dryness, as well as preserving bone density and reduce the risk of osteoporosis. While as in men, they are typically using it because with low testosterone, they have low energy levels, low libido, they notice muscle loss, as well as mood issues and fatigue. Now, I want to shift gears for a moment and talk about something that really doesn't get enough attention, and that's the potential downsides of using hormone replacement therapy. And before we go any further, I want to be really clear that it may be helpful, and this isn't about fear. It's definitely not about being anti-medicine. It's just understanding how the body really works so we can make informed decisions rather than quick ones. One of the biggest things to understand about hormones is that they don't work in isolation. They work through feedback loops between the brain and the body. The brain is constantly asking, do we have enough hormone? And do we need to make more? When hormones are coming outside of the body, which is a exogenous hormone, whether that's estrogen, progesterone, testosterone, the brain is often getting messages that production isn't necessary anymore. And over time, that quiets the body's ability to make that hormone or to signal for that hormone production. For many people, this suppression may be reversible, but the longer someone is on hormone replacement therapy, the harder it can be for the body to restart that natural rhythm. That's why some people feel significantly worse when they come off of hormones, not because their body's broken, but because it's been a significant amount of time since their body has been told to be able to make it. Another important piece is that hormone therapy often helps symptoms with addressing why these symptoms showed up in the first place. So hormone imbalance rarely happens randomly. It's usually tied to things like chronic stress, poor sleep, blood sugar issues, inflammation, or long-term nervous system overload. When we don't address those root causes, hormone therapy can be a start, but it's not really addressing what's causing your hormones to be low to begin with. But when we are addressing those causes, you have a lot more of a significant output in your health and those hormones as well. So like I said, one of the biggest concerns is how it affects the hypothalamic pituitary endocrine axis. So this is where hormones are being distributed in the body. Hormones operate on that feedback loop. When the brain senses adequate amount of hormone in the body, when we are taking that therapy, then it reduces the amount of signaling that it produces internally. In women, exogenous estrogen and progesterone reduces the signaling from the hypothalamus and pituitary to the ovaries. And in men, When they are getting testosterone, it suppresses LH and FSH signaling, which reduces natural testosterone production as well as sperm production. While this suppression may be reversible, the longer someone is on it, the slower and more difficult the rebound can be. Some people never even fully return to their baseline production, especially with long-term use and higher doses. This is why people often experience worsened symptoms when stopping, even if they were relatively mild before starting hormone replacement therapy. Now, again, hormone replacement therapy can be effective in masking symptoms, but it does not correct why the hormone imbalance developed in the first place. Common root contributors can be chronic stress and elevated cortisol, poor sleep, insulin resistance, metabolic dysfunction, inflammation, nutrient deficiencies, and nervous system dysregulation. This creates a functional dependency, not because hormones are addictive, but because the underlying physiology was never restored to begin with. Another thing to consider is research has shown that timing, dose, and the type of hormone replacement therapy greatly matter. The potential risks include increased risk of blood clots, stroke, elevated blood pressure, changes in your cholesterol profiles, and these risks become significantly higher if it started later in life, which is what most people are doing anyway. The synthetic hormones are used, higher doses are prescribed, and there is a history of cardiovascular disease, smoking, or obesity. Testosterone in men specifically can also increase their red blood cell count, which thickens the blood, increasing the cardiovascular strain or the heart function. So that's why it's so important. Like, if you're on it, you have to be monitored throughout the time. Then there's the topic of cancer risk, and this is where the nuances really matter. Combined estrogen and progesterone therapy has been associated with an increased risk of breast cancer with long-term use. Estrogen-only therapy in women without a uterus carries a significant risk profile. Testosterone therapy may also stimulate prostate tissue, especially in predisposed individuals. Now, it's important to clarify hormone replacement therapy does not cause cancer out of nowhere, but it can accelerate the growth of hormone-sensitive tissues. And if those abnormal cells are already present, then that's where those become elevated. This is why screening and individualized risk assessments are essential. The next thing to talk about is metabolism, in which hormones directly influence how we store fat, regulate our blood sugar, or how our thyroid functions. Many patients are surprised to learn that this therapy can sometimes increase insulin resistance, promote fat storage, cause water retention and bloating, and even alter your thyroid function. While some people may notice that they lose weight initially due to their improved energy, others experience that central fat gain, increased cravings, and having difficulty maintaining their metabolic balance. So diet, stress, and movement are needed to be optimized while on this therapy. Otherwise, it can unintentionally worsen the metabolic dysfunction rather than, quote unquote, fixing them. And then hormones also directly affect neurotransmitters in the brain. Some individuals experience increased anxiety, mood swings, irritability, emotional blunting or numbness, and worsening depression. This can happen when the hormone levels are too high, your ratios are off, in which estrogen becomes more dominant, cortisol is already elevated. And this is especially important when people are starting it in hopes to regulate their mood or their brain fog. And the worsening symptoms can cause confusion and be really discouraging. And then there is stopping hormone replacement therapy, especially abruptly, can result in intense hot flashes, night sweats, insomnia, mood instability, fatigue, joint pain, and brain fog. These symptoms occur because the body has to restart its own endogenous or internal hormone signaling. So from a chiropractic perspective, this is where nervous system regulation, stress reduction, nutritional support, and gradual tapering is really important. Hormones, again, they don't function independently. They respond directly to the nervous system. When we reduce the physical, emotional, and chemical stress, we improve the nervous system's function, support sleep, and help people get better. We're creating an environment where the body can actually regulate itself more effectively. Long-term resilience on external hormones can bypass the neuroendocrine communication, reduce the body's adaptability, and make symptoms less resilient to stressors. This is why chiropractic, we focus on the nervous system. It plays a supportive role directly into hormone regulation. And that's not just with your sex hormones, it's every hormone in the body. And because the goal isn't just to replace hormones, it should be to help the body become more resilient, adaptable, and capable of healing from the inside out. And as part of the Premier community, you know that the body functions as an integrated whole. And hormones are profoundly influenced by lifestyle. So a couple of things to start off your journey in increasing those hormone levels again. Eat plenty of healthy fats, whether that's omega-3s, nuts, seeds. These are your building blocks for hormones. Making sure you get protein in every single meal because it helps build muscle and it supports metabolic health. And then phytoestrogen foods are super helpful for women. This can be flaxseed and soy within moderation for that estrogen support. And then keeping blood sugar stable. High sugar swings disrupt hormone signaling. And then lifestyle, always making sure that you get plenty of sleep. That's where your body is doing the majority of its healing. And poor sleep actually wreaks havoc on cortisol and insulin, which are directly affecting those sex hormones. And then stress management. High stress raises cortisol and lowers your hormone production. So learning ways to decompress at the end of long and stressful days are going to be incredibly helpful. And then exercising is really great because it resistance training supports testosterone and growth hormone, whereas cardio supports your insulin sensitivity. So if you're an individual that knows that you're not producing insulin very well, making sure that you're exercising, especially after meals, is going to help your body regulate a lot better. And again, these are all things that enhance your overall hormone health naturally. And as chiropractors, again, we're not treating hormones directly. We support the system that influences hormone balance. So again, reduce your chronic stress through adjustments, making sure that nervous system is functioning at its highest capacity, and doing so, you are healing the way you need to be. And I mean, hormone replacement therapy, it's not a one size fits all. It comes with nuances that deserve careful discussion and consideration. And whether someone is on it or not, lifestyle, nutrition, sleep, and chiropractic care are all powerful tools to help balance hormones naturally. and supporting that long-term health, so you give yourself the time and effort to commit to these changes, you can see great changes. So you know that God designed you to be well. So support the system that He designed, and you have a great capacity to see what is in store for you. So again, please come see us, talk to us more about this before you make any decisions, and we would love to continue this conversation.